Studio 61.
All right, thanks, Matt. It's time for our Health Watch segment. We are joined by our friend, Dr. Syed Hussain of Trinity Health of New England. Good morning.
Morning.
All right, so we have a couple of topics to tackle this morning. First up, there was a new study out on multiple sclerosis and how it may show up much sooner than when people are actually diagnosed with it. So what has the research found?
Yeah, this is a studies symphony looking at patients with MS and then what happens before they get diagnosed with MS and comparing them to a normal cohort of individuals in terms of healthcare visits. So all-cause physician visits about 14 to 15 years preceding actual onset of symptoms of MS. So they haven't developed any symptoms, but the study looked at how frequently do they use specialists in terms of primary care docs and other types of neurologists, psychiatrists. There's a large number of visits that these individuals actually took from a healthcare perspective compared to the normal cohort, which means there's more research that's needed. But are there any symptoms or disease signs, early disease signs, before the actual onset of symptoms? Remember, MS is a very debilitating chronic disease, and before that, those symptoms start, is there something in that prodromal phase, if you will, that we can pick up on to help guide us in terms of early detection and navigate the treatment strategies for these patients, which may be beneficial.
What are some of these symptoms that folks should look out for?
So vision, great question. Vision, coordination, tremors, pain, back pain, sensory issues, pins and needle sensation. So a whole bunch of, it's basically related to the nervous system that start and then they can progress. There are a lot of different treatment modalities available, but it is a chronic disease, and we're trying to figure out, is there something we can do much before the onset of symptoms?
And should someone start with seeing their primary physician or maybe jump to a neurologist?
So again, the study is before the onset of symptoms, though, so more research is needed to understand what type of signs and symptoms can predict accurately that this individual may go on to develop MS.
Okay, all right. Now for our next one, there was a study that showed more folks under 50 are being diagnosed with colorectal cancer. What's behind that trend?
Yeah, thank you. This is an important topic, and we've discussed this in the past. So in 2018, the American Cancer Society basically lowered the age for screening for colorectal cancer screening from 50 to 45. And the United States Preventive Services Task Force, USPSTF, followed in 2021, reducing the same age from 50 to 45. So now we have data. There are two studies that got published in a reputable medical journal looking at two data points. One is, has screening increased in the 45 to 49 age group? Yes, it has. That's good. We want to see more people get screened. But more ominously, we also saw an uptick in early stage cancer, colorectal cancer in this age group. Is it because of more screening? Maybe, but it's not totally explained by higher screening, which means, if you take a step back and look at the larger picture, we've discussed, for instance, how there's an uptick in cancer in general in younger people now, whether it's environmental, genetic, a whole host of issues. We've talked about ultra-processed foods. There's a lot of research that's ongoing to exactly pinpoint why we're seeing that increase in early cancer, and especially in younger ages. But suffice to say, this study does indicate that early stage colorectal cancer incidence is increasing in a younger age group.
Okay. Now, a lot of folks, especially because we've had, our summer weather fully kick in, they've been outside trying to get those 10,000 steps a day, but there's some new research out that says you may not need to aim for 10,000.
Yeah, 10,000 is 5 miles.
Yeah.
That's a lot.
I've been trying to do it.
Look, here's what I'll say. I think it's more of a marketing ploy.
Okay.
This study basically shows even if you do 2,000 to 3,000 steps a day, you'll still get those benefits. And those benefits include, longer, a healthier life, less incidence of chronic diseases such as diabetes, heart disease. We know the benefits of exercise. There are numerous studies out there, right? But it's how much do I get done in a given week? So start off with 2,000 steps. The studies looked at 7,000 steps, not 10,000, where there's a noticeable benefit to people. So as what I tell people, bottom line is try to get some moderate intensity exercise in. The American Heart Association says 150 minutes of moderate intensity physical activity per week or 75 minutes of vigorous intensity physical activity. So whatever it may be, just get out there. It's great weather. Take advantage of it and get those steps in.
Yeah, a little something's better than nothing.
That's right.
All right, thank you so much,
Thank you.
Doc.